All right, well, I will start introducing, and I think we'll have a few more people jumping in here as we go. But I'm Zeina, for those of you who don't know me. This is Sabina. She's one of my students here. We're in southern Switzerland, so we might be speaking a little Italian here and there, so you can get a little Italian lesson as we go along today. So today, the purpose of today was really to follow up on the discussions that we've been having surrounding breast reconstructive surgeries. And we had the fortune of having Dr. Daniel Jacobs to answer a bunch of questions 2 weeks ago. And then today I wanted to just go through some of the things that he had talked about and some of the things that we can do to help people who have had a reconstructive surgery for, and maybe some of the issues that you might see in people who have had reconstructive surgery, so that if they walk into your studio, you have a toolbox to start with. And so I had to kind of send out a little document, and what I thought I would do is I'll screen share it now. If for any reason you didn't get it and you would like it, you can email me and I'm happy to send it your way. But I'll share it and go through it with you just so that we can have a quick talk through, and then we'll get to demonstrating all the exercises so you can also see them, and I'll explain more as we do them. And there's nothing magic about the exercises. These are all really well-known Pilates exercises. So I don't think you're going to see any magic, but the magic in it is just knowing how to cue, knowing why you're doing what you're doing and what your motive is for doing it. So I think once you see it in that light, I think you'll say, oh my gosh, I knew this all along. But I hopefully just put it in a structure so that you can use it in a way that's easy access for you. So here, just put in, what are those common issues post-reconstructive surgery? And I was trying to keep it general, so we can be talking about reconstructive surgery of any kind, whether it's post-cancer or whether it's a cosmetic issue or whether it's a gender change issue, or not issue, but a gender change surgery. Then we have things that we can do for anybody. So what are the common things that we see? Dr. Jacobs mentioned a couple of times frozen shoulder, so I just did want to touch on that. I think most of you already know what that is, but also medically known as adhesive capsulitis. So that's sticky capsule of the shoulder, and that tends to happen most commonly in women between the ages of 40 and 65. We don't really know exactly why it happens. We do know that it tends to happen after trauma, unrelated to the trauma, that capsule gets really sticky and it really limits range of motion at the shoulder and causes quite a bit of pain. And usually if we do nothing in 2 or 3 years, it will go away all on its own. But we hope to help people get through that a lot more quickly than that. So frozen shoulder is something that might come up post-surgery in any of the area in the upper quadrant, really. Rotator cuff issues sometimes present themselves, and I think that tends to be either a pre-injury or a compensation type of injury because they're using their body in a different way. We see a lot of pectoralis tightness, and along with that, a lot of increased thoracic kyphosis. So if you think about any person, you might see any of this in somebody who's not had a reconstructive surgery, and you wouldn't treat them that much differently, right? Except that if they're really new, if the surgery is really recent, then there might be some precautions that would come from the doctor. The main goals, so our main goals in general with this population are going to be to restore good posture, to restore shoulder range of motion, to restore thoracic range of motion, and to restore cervical alignment. So that would be going from this concave protective positioning into our beautiful, nice, open posture that we strive for anyway in Pilates and life, hopefully. So I did put a little note in here. For those that have lymphedema, that is really a specialty. So I'm a physical therapist, but I'm not trained in lymphedema. I usually send people with lymphedema to a lymphedema specialist. So I highly recommend that if you see that they're having lymphedema, that they are also seeing a specialist, and that if you're going to work with them in Pilates, that either the client themselves or the specialist knows what they can and cannot do. There is a limitation to how much work you can do with an arm, shoulder that has lymphedema at the moment. So having conversation with the client, having conversation with a specialist on that in order to understand what you can and can't do would be really ideal. All right, so then if we're going to go through, I'm just going to take you through this and not show you the exercises first, and then I'll show you the exercises by equipment order so we can see all the stuff on the Cadillac, all the stuff on the Reformer, etc. So basically posture. If we want to look at correcting posture, my absolute favorite way to restore good posture, those of you who know me well know, is the foam roller upper body sequence, what I call the foam roller upper body sequence. So I get people on there and we do some arm opening, chest opening exercises. I love this because I'll explain more as we do it. So I'm going to skip and I'll explain more as we do it. I also just put a note here that pay particular attention. Something that I've seen a lot in a lot of women more that have had breast augmentation or have had a mastectomy and years later have had a reconstructive surgery. After the reconstructive surgery, they tend to be very kyphotic. And I don't know if it's because they get scar tissue or they just get tight in the healing process, but they get very kyphotic and very stiff in that thoracic spine. So it gets very hard to open afterwards. So I just put a note there so that you could pay attention to that. If you know somebody has had a reconstructive surgery, that might be a preventative thing that you want to consider would be doing a lot of thoracic mobility types of exercises, even if they have good posture. So maybe keep that in mind. For the shoulder, shoulder is always tricky because we want to restore mobility. We're assuming that they're going to have a little bit less mobility post-surgery in the shoulder. But we always have to be aware of having the right amount of stability and the right mechanics in the shoulder. And the reason I emphasize that is because the shoulder for me is not just that glenohumeral shoulder, that is our scapulothoracic motion and ability to move and stabilize. And it's also our acromioclavicular connection. It's also our sternoclavicular connection. So we've got a lot of places where that shoulder cannot function. So really keeping an eye on, do we have enough stability in that scapular region? Do we have proper mechanics to allow us this full range of motion that we're seeking? So try and really think about the shoulder as a whole, a bunch of things all put together, not just that glenohumeral joint. And so you want to look at scapular mobility along with thoracic mobility, and scapular mobility go hand in hand, right? And then that everything is working as it should be with the right form. And we'll look at that in the exercises as well. We need, when we talk about shoulder stability, you can think of it as shoulder stability. You'll give them shoulder stability when you're working in a closed chain environment. So when the arms are closed against something, when you're working again in mobility, you can do that in a free way without having to have a closed chain. So stability is like serratus presses, it's planks, it's actually rotator cuff is also a good stabilizer. But then mobility is going to be pec lat stretching, cat stretching, things like that that really open up the shoulder girdle. So finding the right balance based on what you're seeing in front of you is key. If we talk about mobility, we have pec lat stretch, scap retraction, cats. That would be on Cadillac. It could be anywhere really. These ideas, right? On the springboard, the tower, we can talk about scapular strengthening, the rhomboids and the scapular area with rowing types of exercises, chest expansion exercises, using the back muscles to stabilize, but also to open the tight front muscles. So using opposing muscle groups to create the mobility that we want in the tight muscle groups. So that is another really nice concept. On the reformer, I love what I call the reverse swan series for scapular mobilization, for chest opening. And again, I'm going to show you. Also, we've got the seated long box, which is sort of the classic chest expansion, rowing, rotator. And again, we'll look at that. That's more for that scapular connection, and then using those to open up the chest. So when we talk about re-education for the upper quadrant, I really like to use the Cadillac because it isolates things so much. So that's kind of lat work on the Cadillac. On the springboard, you can do also kind of lat work, rowing work, and opening work. Reverse arms is opening. We'll show you that. And then we can also do the thoracic exercises to re-educate the body and get that mobility back in that thoracic spine. Yeah, and so any swan with chest opening as a focus is going to be helpful. Mat, reformer, Cadillac, it's all super valid. Arc, barrel, right? Cervical spine, we really look at the cervical spine because without the head in the right place, we can't restore normal posture. But also without the thoracic spine in the right place, we can't have a normal head posture. So both those things work together. For the cervical spine, I do a lot of work just working on how do you place that head on the shoulders. And so we will look at some of those as well. We could spend all day on all of this, but I'm trying to bring it down to something doable. So any thoughts or questions so far?
I just wanted to pass on a comment that was in the chat box really quickly. There's a person who's not a practitioner or familiar with some of the terminology. So just wanted to let you know that there's a layperson in the audience. And so if there are any main ideas that that you feel like would be important to say.
Yes, please ask for clarification. If I say something, I get talking sometimes and I can always clarify. So no worries there.
We'll keep our eyes peeled. Thank you.
Okay. All right. So, yeah, go ahead.
Zeina, does this apply to like top surgery as well? I think we mentioned it, but I just wanted to confirm, like when people get their breasts removed.
Yes, so you're gonna see, I believe, very similar issues if somebody had their breast removed as well. What the difference is, and I'm not sure I have research to back this up, but the difference is what happens after. So if you add to the front of the body, you have to be able to balance that with the muscles on the back of the body. So thinking about it in that light, you may not see as much of the closure or the thoracic stiffness and kyphosis, maybe not. However, if there is scarring, you might see that same thing. And post-surgically, I think before the person is comfortable standing up tall, I think you might see some of that, but maybe not have that lasting stiffness in the thoracic spine. That's what I would expect the difference to be. So, yeah. Okay, so I'm gonna stop this screen share just so that I can see all of you better as I go through the exercises. What I've done at the bottom of this little handout is I put the exercises in a row per apparatus so that we can stick to one apparatus, and I'll try and explain what the uses are, but I wanted you to have what I wrote earlier, because that would be a really nice reference if you're looking for a specific, okay, thoracic area, what should I do? Cervical area, what are some options that I could do to get me started, sort of thing. So, and if it gets confusing, you're not sure what I'm talking about, feel free to pipe in and I will explain, okay?
So while you're doing that, I'm just going to read a comment from Yelena in the chat. It says, you have the stiffness in your chest area a year after the double mastectomy. After the double mastectomies and reconstruction, pectoral exercises are difficult to handle.
Right after. Yes.
That feedback.
Yes, definitely. And I think I'm not speaking to really directly after surgery. I think, and I think you would just grade the exercise so that it would be appropriate for the person at the level where they are. So yes, I agree. A lot of these exercises I'm going to show you are going to be kind of more extreme. So these would be people who have completely healed or maybe 6 months and up away from the surgery. And we can talk more specifically about right after or maybe 8 weeks after surgery, if you have questions about that after too. So
and they added even after 8 years, just as a follow-up comment there. So on the long term.
Okay, so yeah, I think it would be very personal. Okay, so here we go. Sabina is gonna be our lovely model here. She's super thrilled. I'm super thrilled. And I'm gonna excuse myself because I had knee surgery. And so I'm gonna hobble around as I move. So excuse my hobbling as we go. All right. Okay, so we're gonna start with on the mat roller. And I'm gonna put her onto the roller first. Okay, so this is what I call the upper body sequence on the roller. And usually I have people just lay here for a moment and take a couple breaths just to relax their body. So she'll just breathe in and then exhale and let herself just fall here as she's falling. It gives me a moment to see what her posture does when she can lie down for a moment, where she kind of lands, what her head and neck posture is doing, what her chest is doing, what her shoulders are doing. So I get a moment as they're breathing and just sort of resting and letting their body get heavy to see what's happening here. From here, and here would be a place where you can kind of judge intensity. This might be as intense as somebody can handle, right? Or we can progress from here. So I will have her take her arms up to the sky. And then this is arm reaches or shoulder slaps. You're gonna reach up to the sky, inhaling, and then exhale, she'll drop down, right? Letting those shoulder blades hug the roller underneath her. So just a really small motion. It is serratus that does that action. So serratus is on the front side of your shoulder blade. Right, up and then down, right. And so it would, when we load it, we will load it later so she can actually strengthen that. That would be a stability exercise. Here we're looking at mobility, yeah. And then we'll go to arm reaches. So one arm reaching back. And here what I like to cue is, I like to cue the shoulder blade still traveling down and letting her go as far as she'll go without overarching her back, right? So her back stays neutral. Okay. And then she'll inhale the arm up and switch sides. So yeah, rib cage falling in opposition and the arm just goes where she can go. So we don't want to see huge arching or too much effort. We're letting gravity do this work. So it tends to be super gentle. And you could even have them take both arms at the same time if you felt like they could manage that as well. So this makes it harder to stabilize, obviously, creates more stretch, but also gives me a chance to see a different side to side. So if somebody had a single side reconstructive surgery, then you might see quite a difference from side to side and have a goal or any sort of unevenness that might appear there. So I really like that one to see that. Also to see how much strength they have, how much tightness they have, how well they can stabilize. And then from here, I usually take the arms back up and then we open out to the pec stretch. Now this can get quite intense, especially if you have them up on a high surface. So because she here doesn't have the floor to stop her hands, but even with the floor, for some people, it would be intense. So you could take pillows and let them by the sides, or you could have them just do it on the floor at first. So the arms don't have to go too open. Also, you always have a choice of where the arms go. So for those of you who know the anatomy, right, pec minor fibers run much more diagonally across the chest. So if I take her arms up in this angle, we're more into pec minor stretching. If we take our arm more out to this side, we're more into pec major stretching. And from our conversation with Dr. Jacobs, we found out that right the ones that are underneath the pec muscle would be underneath that pec major muscle, and so they would get really, maybe you'll see the breast move, or they'll be uncomfortable if there's too much tension on that pec stretch here. So that would be probably the more down or the more horizontal stretch, I would assume there. So just to be aware of that. But we do want to get that pec to open up so we have normal function. Right. And then relax. So that would be the roller sequence here. But yeah, when you come off. And then the other ones on the roller that I really love are the thoracic mobilization. So here she put her shoulder blades on the roller and the hands go behind her neck. And I need to pull them up. And then she'll just stay here and let herself fall over the roller a little bit as she breathes. So this is just a nice opening. If this is too intense, I find putting the squishy ball behind the shoulder blades could be really nice and not as intense. So that would be another option. And then we could also have her come up and then lift the hips up just a little bit. And then you can push. You can push backwards with it. Spinning con le gambe indietro. Sì, e ripieghi. There you go. So you can roll that thoracic spine. And if that feels fine, you just stop before the lumbar spine, right? So we're just trying to get a little more mobility in that upper back area with this. Great. And then the last one here, is we can also use the cat here. So she could put her hands on the roller and she's just gonna roll out into the cat. And this we can do here, we can do it on the Cadillac, we can do it in a lot of places. So this is more intense, right? So this wouldn't be somebody who has a lot of pain. I do like to try and roll the thumbs upward because that opens up the anterior shoulder, right? So somebody with sensitive shoulder, the thumbs up opens, and then she's gonna work to let her chest fall. I like to say chest fall between your arms here. So she's just really working to open up the chest, letting that shoulder blades come a little bit together on the back. Yeah. So that would be the things that my favorites on the roller. Let me just check my list, which is too small to read from over there. Okay, and then we also have the thoracic extension over the arc. So we could do that over the arc or over the barrel, or you could do it like we did over the roller. We'll just show you the arc really quick. And there. So this, what I love about the arc actually is that she gets to decide how intense to make this. She can scooch her bottom forward or backward. To make it less intense would be more forward. To make it more intense, she'd scooch backward. And then we could also leave her here in this position. This is going to open again a bit pec minor and the upper back. I could support her head or put a pillow back there so her arms don't even have to be there. And we could really work on the thoracic, or we could take it a step further and have her rest her head down. And this would be the most intense, right? So now we're getting shoulders open, upper back open, and a lot of intensity. We can see any difference from side to side also here, which is kind of nice to see. So this would be another version. You can do the same thing on the big ladder barrel as well. Feet against the ladder and then positioning the body this way. Again, picking your intensity based on the position of the back over the arc. Okay. All right. Thank you. Okay. And then from here, any questions on those, or do you guys feel good about those? Yeah. Okay. So if we move to the Cadillac, we've got a few different exercises. The first one is that serratus press with just stability. So we'll do that first. Here, look at the front. So this is sprung from below. And you can decide how much weight you want to put on here. I'm putting on just one spring for now. This is a little bit light with two arms, but it is quite heavy with one arm. So you could switch springs or you could just have it this way for the whole time. She's gonna scoot down so her nose is under the body. Okay. And then she's gonna move her hand together, push the bar up, straightening the elbows. Great. And then she's gonna work from her shoulders, right? She's gonna push the bar up to the sky. And then let the shoulder blades come back down. Keeping really open in here, right? But here again, we're working that serratus muscle. Again, that's the one that holds your shoulder blade against your back. Why do I care so much about that? Because without stability there, we can't have good shoulder mechanics. So if we can't get this stability, we're never gonna get a good motion through the arm. So this is my favorite, again, stabilizer for somebody who needs more stability. And I would do this before I would do mobility exercises, make sure that they understand this, and then add the mobility exercises on top. You could do it with one hand on, one hand off. So if you just a lot harder on one side. So pressing up. And then controlling down. Yep, pressing up. And then the other side. And then down. And then up. Beautiful, right? So pretty straightforward, but just gets those shoulder blades moving and stabilizing that shoulder girdle.
Then I have a question about that one.
Yeah,
So when you shrug your shoulder off the mat to press the bar away, your pec is engaging. And then when you draw the shoulder wide, is that when you're finding the serratus, or do you have the serratus on the power up as well?
yeah, it should be all coming from the serratus. The pec, you might feel the fibers tighten a little bit, but they really shouldn't be the primary. Pec is gonna work a little bit more when we close in front. So if you imagine hug a tree or even butterfly, that's that closing arms in front, then we're working pec to pull the motion, to pull the arms forward. Here, we're working back to push the arm up out of the side. So here, it's from back here that she's doing that work. She's to sustain this hold and then push away. It's, if you want to imagine it upside down, I think you'll see it. It's the plank.
So it's both on both ends, it's working.
Yes, on both
'Cause I
ends.
feel my pecs when I push the bar away.
So maybe we need to reposition your hands a little bit wider. So that you can feel the scapula actually doing that motion rather than you closing to push the bar.
Perfect, thank you.
Yeah, thank you for that question. That's a good question. Okay, so I'm gonna switch the spring so that we're going from above now. Again, you have a choice on the springs here. You can do just one spring or you can do two. The one spring is gonna give, I think for this next one, I would just do one spring to start off with, and then for the cat, you could decide, depending, or you could even do 1.5 or one heavy, one lighter. So here, I'm gonna have her sit up. This is the seated double lap. Cool. I'm gonna go down behind the knee. Okay, and for this one, I love to sit myself right behind them because I feel like in this position, I have everything to control and I can see what's happening really directly. So I'm gonna move back so that hopefully you guys can see also. She's gonna put her fingertips on the bar, outside of the bar, just relaxing them there. Yeah, and then I'm gonna encourage her to just relax her arms, relax her shoulder blades down her back and let the arms get heavy. So she's not holding her arms up, she's releasing her shoulder blades down. Right, so I can get this, and this is mechanics. This is one of my favorite exercises to retrain the shoulder mechanic. So I can have her think about pulling the shoulder blades and that connection from the shoulder blades across to the opposite sides of the pelvis, right? This diagonal line here is what we're after. So I'm gonna have her think about heavy elbows and then let the elbows just sink down towards the hips. And as she does that, try and find this connection across her body. And then in the meantime, she's gonna end up keep going down. And the head is gonna grow up in opposition. So she's gonna keep going until she can't pull down anymore. Right? And then a lot of times for people who have a lot of difficulty figuring out what I'm talking about, I have them hold down at this bottom place and just work halfway up. Because in this bottom place, it's the easiest to feel this connection right down here. So we can work to stabilize the shoulders from below, from the lats, the lower trapezius. Okay, and and then without having the work happen in the upper region. So then we can freely move the shoulder with some stability from below.
Zeina,
Yes.
how far back are the elbows? Are they a little forward or?
Yeah, that's a great question. So the elbows in Sabina's case are a little bit forward, especially on this left side, because this left shoulder really wants to roll forward. I want to place them so that I get as much open shoulder as possible. So if somebody's really flexible, you can get the arm parallel with the body. If they're less flexible, the arm needs to come a little bit forward, because otherwise, I'll turn around so you guys can see. Otherwise, if I get the elbows too far back and I'm not flexible, I get this forward rolling. The other thing you can do is try and cue the elbow forward. Sometimes cueing that elbow forward helps me open up and wrap backwards through the back body. So I can think about the string from the front of my shoulder around the top of the shoulder and back down. It's kind of the lat. The lat actually inserts here if it's not been used for the reconstructive surgery. But if, I don't like to think of it from here because that makes me want to go this way. I prefer to think of it from here, coming up and over and down to open me up, right? So that elbow angle, you can definitely play with that to help the shoulder blades sit down the back. If you see that there, you're getting this, or sliding the hands forward, and then still playing with that elbow angle. So elbow tips slightly forward. Yeah, and again, depends really on the flexibility. Go ahead, Elaine. Yeah.
She has excellent control in her front rib cage, I notice. But
Yeah.
I would predict that much back might result in doing it from a different place. Yeah, instead of the shoulder.
Yeah, and this is a whole, we've had discussions about this before, but this brings up a whole nother topic, right? When we're trying to work on shoulder blade, a lot of times we're balancing between shoulder blade working and rib cage control. So my recommendation, and I think we could have a conversation about this, and people will have totally different opinions about how you go about it. I don't think there's a right and wrong way. I think there's many ways. My approach tends to be, if I'm working on the back body and they're in a reasonable place, I'm not going to worry too much about how open the ribs are. I'm going to just work on that back body in that moment. I do want to work on the control and strength of the rib cage, but I might do that in another moment when they're supine, probably in that moment. And then remembering that it's not just a choice. If they're tight in the upper area or tight in the shoulders, they may not be able to get in the position we want them in ideally at first, until we stretch and strengthen and balance everything. So maybe deciding, okay, maybe the arm should be more forward because we're really getting this hyper extension, or maybe I can push them a little back because we're in a decent place. So does that make sense?
Yeah, and I can tell that in a way, sometimes you may want them to get the feeling of it, because that proprioceptive new sensation in here is worth a little bit of, forgiveness in the ribs.
Sabina's too good at it. No, brava. If we take our arms back far enough, we're gonna see on this left side, we're gonna start to get the wrong thing, right? I see, look at where her head went and look where her shoulder's now going. So it's really hard for me to put her here and ask her to lift that head up, to open this lift here without, and still take this shoulder back and down. This is a struggle now, right? I don't have enough hands for all of that. So now if I put her back where she was, then she can find it herself, right? She can find that down motion. She can keep that shoulder back. She can find that length on her own. Yeah. So I just need to pick my, and I'm not cueing her ribcage, and she's just nice and strong and doing a great job there. So, but you want to decide what your goal is in that moment, and then work for that thing. And then definitely work on the other stuff, but maybe in a different position or at a different time. Or you do 5 one way and 5 another, if the exercise is appropriate for both those things. Yeah. So if we go from this, if this is too much, sometimes this is too much, or sometimes you're just not getting everything you want out of it, then I have them do the single arm lats. So that is, so she'll sit side sit. And then I'm gonna hop around And then come to the middle of the table. Yeah. The hand, you have the choice here, right? Underhand grip or overhand grip. The difference, let's look at it. If I am underhand grip is a lot easier. It's a lot easier to get the shoulder in the right place and the scapula in the right place and the elbow in the right place. Right? If I keep her here and have her flip her hand around, I have a lot more work mechanically because now I have to also place this, make sure that as she goes, this stays back and down, right? And she's gonna work harder for that. So it's a great second step to the first step. Yeah. The other one here, if you have them strong enough to do their hand this way, we can pull the bar through and then push it. This part's always really challenging. So sometimes I'll just help them push it out. And she can, from here, we can work on that shoulder control. So I can ask her to push away, pull, and then pull it back into the socket. Right, spingi un po' avanti e tirano indietro. So I'm getting the shoulder into the socket, and I'm also, which you can't see from here, I'll have her turn around, getting her shoulder blade to fire into her midline, to slide into her midline, and her shoulder blade to travel away, and her shoulder blade into her midline. Poi girate che facciamo vedere dall'altra parte. Sì. So if we go here, she's gonna come down. I'm just gonna see what she can do, and then I'm gonna help her when it gets hard to push through. And then I always like to roll that wrist right over the bar. And then this is the side that's more difficult for her, positionally anyway. And then I'm gonna have her push away. And see, there we go. There, and then it's gonna come back into her midline there. Yeah, so she'll push away, there she goes, now she's getting it, and it's gonna come back. Yes, and push away, there you go. And come back, great. So it's a really nice scapular mobility. This might be good, and if you're feeling the pec work in the serratus press, this might be a nice way to sort of release those scapula and then try that again. See if they'll do more work in a different exercise. Yeah. The other things on the Cadillac with it sprung from above, or the other main thing is the cat again. It's a lovely exercise for opening. This is going to be somebody who's quite advanced though, right? So in ginocchio. Yeah, perfect. Okay, so here I'm going to try and stay out of the way. She's going to pull the bar down, push it forward. She'll tuck her chin and she's going to follow the bar forward. I'm going to switch sides so that I can not be in their way. You can stop them here. So keeping in mind that the rise, as soon as they go past the risers, the whole intensity changes. It gets a lot more intense and a lot more stability needed. So you can pick from here. I can have her stop here. I could have her travel forward more, but I'm going to do it on the next one. So hollow upward and indietro. Costo destro, schiena rotonda. Dopo la barra va in su, sempre una barra con il petto. Spingi un po' in avanti, invece di su, vai in avanti con il corpo. So she's going to go forward with her body. Instead of pushing the bar up, I love to cue forward body. So the forward body motion opens the shoulders for me. And I don't get this upper shoulder action because I'm not asking her to push up on the bar. If I ask them to push the bar up, what you get right away is this all the time. Yeah. Yeah. So I ask them just to lean forward into the stretch. And then we repeat going back. Okay, it's not coming up right now, sorry. But we can't go forward because I have those on. But she would go forward and through. So if you were gonna go more forward, she would come off of her hips, and put them both there, and then she could drop even more. So you see, the hips are up more. She's gonna drop more into the chest. And then we'll reverse, coming back. Yeah, so the nice way to open shoulders and thoracic together here. She loves it. I need it. She needs it. There. Okay, so I think for the Cadillac here, those were the main ones. Let me take a quick look again. I'm sorry, next comes. Okay, oh, pec lat stretch. Yeah. So pec lat stretch is the other one we could do. We're gonna come. So for pec lat stretch, there's a lot of variation here. If I have her forward, we're gonna get a much more intense movement. If I have her backward, and again, the bar doesn't pass the risers, it's gonna be much less intense. So you could decide based on position, what, where you wanna have them, or the intensity based on their position. So here, I'm gonna pass the bar over her head and have her hold on to it. Yeah. So I have her sort of, I would say this is a medium position, a little more intense. And then she's gonna go ahead and bend her, sorry, not bend, she's gonna slide her shoulder blades down for that. And then release the bar long again. So again, looking for scapular motion. And then reaching. There we go. And then reaching long. And shrugging down. And reaching long, great. And then she could bend her elbows, but we're gonna take the shoulder blades down first. And then bend the elbows back behind her head, so rising the elbows up, high. There you go. No, because you're then, and then we lengthen them again. So she's gonna pull back, elbows wide. And then go long in front, right? And I can augment that if I want to. I can have a hand here to help her keep this chest down and really open those shoulder blades. And the front. So this is super pec. This is not something you could do. And you have to remember that they have to be able to lay on their stomach also. So those are things that you would have to pay attention to before you could do any of these. And then swallow. Allora qui, here the shoulder blades go down and the chest is gonna come up. Now here in all our swans, when we're looking at upper back chest, we want to think about creating, not taking the arch in the lower back, but creating that opening in this thoracic spine. So you can see that if I let her, if she wasn't trained and I let her do whatever she wanted, she's going to go right here in the lumbar, which is not where we want her. We want her to go down a little bit lower. Right, I'm going to just kind of put my hand here. It's like I'm scooping her forward, and then I'm going to ask her to come up again. Yes, so I might stop that motion, but I'm getting her a little bit more in that thoracic area now. The other way I think about it is these ribs, these lowest ribs stay down. They don't get to lift up. So we only want to come up from that upper back area, not have her lift up more and get to the lower back if we're trying to open thoracic. Great. That's it. Okay. Thoughts, questions? I better get moving. We have a whole bunch more on our list. Okay. We'll do the springboard ones. I'll take you through those pretty quickly, just so that you have an idea. They have the same theme as what we were just working on. The box on the floor series, I fondly named it that. Okay, so this is really, the same single arm lat work at first, but just with the bar instead, the moving bar on springs versus the fixed bar over there. So not as stable. There we go, not as stable, but also, does that make sense? And then I have my bar pretty high up just to create some resistance. She's gonna hold on under there she goes. And then again, I like to sit here with them while they're doing this one so that I can help guide what's happening here. So it's that same idea of the shoulder blade coming down, elbow coming in, and this one we can get a little more angle. So I can direct her elbow into her body here. And I can keep that shoulder back and watch, her shoulder's a tiny bit forward, but if I take her elbow forward, I get the shoulder back. Yeah, and then we can close in to her side. And then slowly release it. Right, so that would be the motive here, or the work here. We could obviously do it on the other side, but I'm gonna make her very uneven, so she wants to come back and play with me again. The other one here, poi sederti qui con I piedi in avanti. Okay, so I've got her seated on the edge of the box. She's gonna hold on to the bar again. So depending on the size of your bar and the size of the shoulders, you could decide where the hands go. Sabina's pretty small and this is a big bar. So I'm gonna keep her hands inside. But if I wanted to get a little wider, I could go to the outside. I'm gonna have her here hinge backward. So her spine is gonna stay neutral. Spine dietro senza piegare. Sono un po' indietro. Tutto si tiene su qua. So I really need to cue that lower back to stay up. Ecco qui. I want her to stop when her arms and the springs are in the same line. And then I'm going to have her pull the bar to her chest. Allora tira, con I gomiti si tira. Tira la barra, apri qua il lavoro, vieni qua dietro, just no. And then you let the arms go again. So she's pulling back. She's focusing on shoulder blades pulling on her back as she pulls the bar to her. Here we have her elbows narrow. I start with narrow elbows so that I don't get this upper trap overwork. Eventually in this line, you could take the elbows wider. So she's doing a pretty good job. And the reason I like this hinge back is because I put her in a line that makes it harder for her to go up. So I'm a little more certain that I can get what I want from the lower trapezius, middle trapezius, and then the lats going downward. Ecco, perfetto. And then she'll come up vieni su in piedi. And then the other one here that's a nice opener is, I call it reverse arms. You're gonna want to adjust it based on the person's size and height. So here I'm gonna bring this down a little bit. The higher the bar is, the more intensity we'll have to it. And then she's gonna turn around and she'll put her hands on the bar here. Yep, that's it. So already you can see this is an intense position. I have her pretty close. I have the bar pretty low, but already we're working on opening, squeezing, and then I just have her pull the bar towards her bottom. So again, she needs that nice control that she has here in front. Right, I just had her shift the weight to the balls of the feet and keep it there as she goes, and then she can release the arms and then pull down again. Kind of tight, pulling in and slowly release. Yeah, so again, this is quite intense, but you can decide if it's right for your client. There's a lot of pieces here, right? Weight has to be forward, shoulders on the back, tummy lifted. Yeah, Anna, go ahead.
Just if they're hyperextending the elbows, would you just cue a little bend of the elbow with it going up to the sky a little bit?
Yeah, so piega un pochino qua. Sì, tutti e due. There you go. Ecco, you would just cue it like that. And if they're trained, they'll do it right. If they're not trained, they're gonna have a hard time. So you may need to adjust the weight, make it a lot less so they can feel it. Yeah. Okay. So we're moved to reformer. If you give us just a second to switch this around. You know, more like that. Let's see one. It's. Okay, so here we have our reformer. Just get the exercises. Okay, so on the reformer, we're basically you have the choice of working on the box or on the arc. The arc tends to be more difficult, but the interesting thing about the arc is that you could have the breasts really off the arc or not pressured by the arc. So that might be a viable option. The arcs tend to be really firm, so maybe putting a nice cushion mat on top because you're trying to alleviate discomfort, not create it. So I'll show you on the box because I think more people have the box, and you can also adjust the position. But if the breasts are off the edge, then you probably want to have a sticky pad underneath the rest of the body because they'll be quite a ways off the box. Yeah. So we will start with the reverse swan, what I call the reverse swan series. E poi vieni sulla pancia. Le mani? Sì. Okay, so spring-wise here, right now I just have one red spring. My goal with one red spring is really just opening, not working hard. So that's why the spring is light. If you wanted to work strength, you would put a heavier spring, yeah? So here, we'll start with just to press it back. You're gonna open the hands wide. Elbows follow the same line. And she's gonna just press backwards, spingi indietro. Cosa? Con le braccia. Spingi indietro, spingiti indietro. Ecco, giusto. And then you'll bend again. Yeah. So she's just pushing back. This is great because I get to see what she's doing mechanically. I can see these in my mind. I see these diagonal lines again, right? Hand, shoulder, across the hip. So I'm creating this line and asking for her shoulder blade to connect to the back of her body and this side as well. And I can work on opening the shoulders here. It actually usually feels quite nice. It's not as intense of a pec stretch, but again, you'll just have to evaluate if they can lay on the chest or not. Yeah, you could move them forward so their nose is further over the bar and then the breast would be off. That's another option. Then from here, we'll narrow the arms in. She's going to extend her elbows straight. And then she's going to bring herself up into swan. So same swan we had, that she's sliding a little bit, so we'll just readjust our body back. So she doesn't go flying up. There we go. See, through that too. And then she's gonna come up with her chest. Again, I can do the same thing I did with my hand earlier. Cue this forward, leaving her ribs downward, and asking her to try and wrap the shoulders onto her back, keeping that neck nice and long, right? So Sabina could use more thoracic opening, and then she'll push away. Same thing, scooping her up, keeping that space here in the lower back, so she can open up above my hand here. So I'm really just opening against her body. So just to cue what I'm after here. Okay. So, shoulders descapolate, posso venire un po' più sulla schiena, insieme qua. Ecco, brava. Così apro di più. Yeah, and she feels it more. If I cue the shoulder blades to come, if I cue the shoulder blades to come more together, she does feel a little more open in the chest. So you could cue those shoulder blades to come towards each other while they're trying to swan upward, and that will help open the chest. Is it ideal shoulder blade positioning? Somebody who has weak serratus, you'll see their shoulder blades come off their back a bit there. So it's a balance of, am I trying to get shoulder blade stability? Because then I wouldn't allow that in this position. Or am I trying to get thoracic mobility or pec opening? Then I would allow that in that moment, right? So just a balance of, again, what are you focusing on in that moment? And choosing how you want the body to be in relationship to that. Yeah, so this on the reformer is one of my favorites. I'm gonna have her sit up now. So she'll sit up, bacino qua piedi. So this is your classic, right? Your classic seated long box series that we all know. Piedi qua, piedi là in vitro. Piedi qua insieme, bacino in vitro. And again, here you're gonna want to keep the weight really light because that way, we know we can get what we're after in terms of scapular positioning. So I'm gonna bring it down even. I have one red, I'm gonna take it down to one blue. So one very medium spring, as I have her here, so that I get the right mechanic. And then if I wanna add weight, definitely I can do that. So here, I'm gonna ask her for her palms to start backwards. This is our more classic way, would be pulling this way, the palms coming backwards. So taking a breath in, inspirare, espirare, tira con le scapole prima, poi le mani seguono. The shoulder blades come together first, the arms are gonna follow. E devi passare il corpo, giusto, tieni la posizione qua. So I have her pass her body, hold the position, find the scapular connection, drop the shoulders down, beautiful. And elongate the back of her head, she can do that by herself. Yeah, and then I'm gonna have her release, adagio, andare avanti senza perdere questa connessione qua, without losing this connection in her shoulder blades. So I don't want her to just go, which I want her to maintain that strength and stability as she goes. Expirare, so exhaling to pull back, shoulder blades coming together, right, rolling up through the center, yes. And then slowly releasing, almost reaching into the floor a little bit to go forward, so that we get that downward motion. Okay, adesso incrociamo le corde. So now we're changing. This is you're again rowing, basically la pointe or rowing. The elbows and classically are coming high. I like to again coach it elbows low. So tiri prima metti qua a lungo il corpo, usando questi per iniziare e poi in avanti. And then forward. So here we're gonna hold at this position and then reach forward. So just that 90-degree elbow. It's a small motion if I keep the hands in my handles or in my glutes. I could coach it with a higher grip or a longer grip, and then she'd get more, but this is my goal for the moment. So I'm not that worried about how much strength work we're getting. I'm working on this opening. Yeah, and this working, what I was trying to say earlier when we went through it is that if I'm working back here, I am by default opening in front. So there's two ways to stretch any part of the body. I can stretch it passively like we did on the roller, where I'm just opening and stretching, or I can stretch it open by activating the opposing muscle group. So a much more active way to do it. And I think there's benefit to having it both mixed in. Yeah, go ahead, Anna.
You have her palms down, correct?
For the moment I do, and thank you for that. If, let's go back to the first one. If I'm having trouble with the palms backwards, so the palms going backwards has a tendency to roll the shoulder forward. So I have two choices. I can have her turn the hands sideways. So her palms are now along her body. Or, and when I do that, when I see that's an issue, I usually have them start here. And then when I get here, I have them rotate their palms forward. because that rotation of the palms forward is gonna help me open the front of my shoulder. Yeah, so you can play with that if you're seeing that as they pull back, they get more and more forward. I can turn the hands and try and help them find that open positioning. And then maybe. Echo. Yeah, so really keeping that open. The last one in this little series is the rotator. Incrociamo di nuovo le mani vengono strumenti sotto così. Okay. So in the rotator, I gomiti vengono lungo il corpo. She's going to bend her arms, bring her elbows right to her body. She's going to open the shoulder, open the shoulder blades here, and then she's going to rotate her hands open. There she goes. So rotator is rotator cuff, yes. It's an extreme external rotation though, so I actually don't use this so much when I want to strengthen rotator cuff. I'm thinking more about stabilizing scapula in this position. If I want rotator cuff, I just do basic internal and external rotation in a smaller range, like inside the body. But here, what's nice about this is I can work on this scapular stability to allow that external rotation in the shoulders. Yeah. Oh my goodness, I've already gone over it. Oh, that's so I promised some questions at the end, and I'm happy to stay longer. I know that I've run over our time, as I tend to do these days, a lot of. But if you guys have questions, I'm happy to stay and answer some more questions for you.
Zeina, there was a question that just came to me about if there was going to be a recording or the slides sent out via email.
Yeah, so hopefully you got that handout already, and if not, feel free to email me and I'm happy to send it. And then we are recording, so I'll have Tiziano send out the recording to everybody who's signed up for the class. Yeah, hopefully that would be helpful. You can laugh at hopping around when you're not so focused on the exercises. Yeah.
Can you take?
Go ahead, sorry.
Sorry, I just have a question. Can you take a minute to talk about a little bit more about frozen shoulder? What happened to a shoulder that,
To make it get frozen, or yeah. If I had the answer to that question, I think I would be famous, because we don't really know why that happens. So it can have, we call it an insidious onset, meaning there's not like a trauma specific that we could say everybody who has frozen shoulder has gone through this at some point. What we tend to see is that it's frequent. So after a shoulder, like a rotator cuff injury or a labral injury, or even a traumatic like arms out fall injury that doesn't show up as a tear, those things we see a lot of times turn into a frozen shoulder. But it's not necessarily the case. We have people who wake up in the morning and their shoulder starts hurting and then it starts freezing. And we can't really associate it with any trauma or anything that happened the day before. So there is also theory, because of the age range, that it's happening most commonly, which is most common. It happens to men too. So it's not, again, not specific, but most commonly women from 45 to 60, we think of that as the menopause age, where without as much estrogen, we tend to have more inflammation. And since this is an inflammatory issue, it seems correlated. However, like I just said, men get it too. So they're not having it. They might have some drop in their estrogen, but they don't have a huge drop like women do in menopause. So exactly why, I'm not really sure, but the mechanism is usually pain, severe pain, and that pain can go on for a year. Sometimes it's pain for a year, and after that year of pain, it just frozen, but there's no pain for a year, and then after 2 years, it goes away. Or sometimes it's pain and immobility at the same time that lasts for 2 years, and then it goes away. But with intervention, it can last a lot less than 2 years. If we don't do anything in 2 years, it will go away. A lot of times we end up, doctors end up prescribing a cortisone injection to help get the inflammation down, and then a lot of mobilization. What's great about a frozen shoulder, if you were going to have a shoulder issue, is that there isn't really damage there unless there's some other comorbidity, meaning I can mobilize that shoulder safely even if the person has pain. I just need to know that it's frozen shoulder and not something else, not a rotator cuff tear, for example, or a labral tear. So somebody who has a pure frozen shoulder, it's safe to mobilize them. So for Pilates instructors, it's safe to work with somebody who has a frozen shoulder. The limits are what they can handle themselves, what they feel comfortable with, as long as you know that it's just that and not something else on top of it. Yeah. And hopefully that's helpful.
Yes, thank you.
You're very welcome. Anything else?
Yeah.
Yeah, go ahead, please.
Hi, thank you for letting another layperson sit in.
You're welcome.
I think Heather, my sister, told you I am pre-op. So this is really interesting to me at this time. I'm having a lumpectomy in October. And I'm wondering, has anyone ever developed like a little guide for especially stabilizing or strengthening or opening up before? Because with my hypermobility and my rib cage is torqued and everything,
Yeah.
it might be, I'm trying to think of what I can do now for, you know.
Yes, that is a fantastic question. I don't know if there's something already out there, but the stability exercises for the shoulder and for the scapula are perfect. Especially for somebody who's I'm thinking on the hypermobile zone, I would be all about stability of that shoulder blade and proper mechanic. So a lot of these exercises really would apply. And if it was somebody who's tight, then you would do a ton of opening work pre-op so that you're set up, you have that open musculature. You're not fighting a pre posture that was already stuck.
Yeah.
And so normally people who are hypermobile have the opposite problem, but just too much mobility in that thoracic.
Yeah.
So I'm all about getting enough strength in the upper back, in the thoracic area and the shoulder blades to support you in an upright posture. So that if there's scarring and things that want to pull you forward, you have strength to hold you up. Yeah.
Thanks. I'm looking into that here to see what I can do.
Yes, and feel free to always send me a message. I'm more than happy to help you with that. Yeah. Yeah. Great. Well, thank you guys so much for being here and taking the time. I really appreciate it. I just love to have this opportunity to be able to help people become better, whether you're a lay person or whether you're a Pilates instructor, just kind of to help and outreach as much as possible. So if you have questions, I am more than happy to respond to your questions, even get on a quick call with you if you need help with something or you think I can be helpful in some way. I'm absolutely happy to do that. So